It's my pleasure to introduce Dr. Michael Wood, who will present to you on the topic of weight management and nutrition as it relates to heart health. Dr. Wood has over 25 years of experience in weight management and nutrition and weight loss surgery experience. Currently, he serves as the medical director for the Bariatric Program at the Detroit Medical Center. He will talk to you about health and wellness.
Good morning. I'd like to talk to you about healthy lifestyles. What does that mean? Well, it's a combination of things. Exercise, physical fitness, making sure that you have the proper nutrition, making sure that you have the proper rest, making sure that you're not participating in activities that are somewhat dangerous, like cigarette smoking, or doing activities that are real dangerous, like maybe hang gliding or climbing Mount Everest. So those are categories. So let's look at physical fitness. What does that mean? Well, it means getting the proper amount of exercise. And so an example, if we were to exercise for 40 minutes on a treadmill or on an elliptical, and we did that at a moderate speed, you'd burn about 400 calories. If you did that every day, that means every day in a week, it means you burn about 2,800 calories. Well, that's not very much when you talk about weight loss, because that's only 2,800 calories. And so 1 pound is equal to 3,500 calories. So you can't possibly lose weight unless you're an extreme athlete by exercising. What is the benefit of exercise? Well, it's a benefit because it's less risk of cardiovascular event. And what I mean by that, stroke or heart attack. We make something in our body, it's called TPA, tissue plasminogen activator. That's the stuff they give you when you go into the ER and having a heart attack or stroke. We actually make our own. So when you exercise, you increase your TPA level, which in turn decreases the risk of stroke and heart attack. So it's very important that you exercise, and so maybe you can't do that every day, as suggested, 4 to 5 times a week, but every little bit helps. Every little helps. So if you're able to get 20 minutes in at some time, even a moderate risk of moderate activities, then you're in good shape. Let's look at nutrition. What do we mean by nutrition? Well, that means getting the proper food content, both in terms of the quantity as well as the quality. So when we talk about quantity, we're talking about portion sizes. So if you're eating the right thing, let's say you're eating protein, which is good, but you eat too much, then those be added calories, because those are still calories. So you want to make sure that you're getting enough protein, enough nutrients in, and that includes green leafy vegetables, watching your portion sizes, avoiding a lot of things like sugar and starch. Now, I don't pay a lot of attention to your fat intake, because you're not going to go home this evening and have a taste for a nice stick of butter. So butter is a flavoring, so fat is a flavoring. So I'm worried more about the butter and bread, or butter and potatoes, or butter and rice, because it's the starch that's going to make you gain weight. So when we talk about starch, we're talking about things like rice, pasta, noodles, spaghetti, cereal, potato chips, corn chips, crackers, those type of things. And they're all kind of nutrients that we use a lot of time. They're snacks that we use, but they're not necessarily healthy. So here's what happens with sugar, and starch for that matter. Sugar spikes a hormone called insulin. And insulin rises to push the sugar into your cell, but you only have a limited capacity for storage of sugar in your cell. That's stored in the liver and in the skeletal muscle. Once you exceed that capacity, it goes right to the fat stores. Do not collect $200, go right to the fat stores. So do not pass a goal. So what you want to do, you want to limit your amount of sugar intake, because you're spiking insulin. Insulin causes you to store fat. Also, it decreases your blood sugar. So when your blood sugar is decreased, that's the greatest stimulus to appetite. Now the same thing happens with starch. Starch is a complex sugar. And when it breaks down to simple sugar, and that same pathway goes that allows you to gain weight. So you want to watch your total intake of calories, the quantity. You also want to watch the quality of your calories, and by avoiding a lot of sugar, a lot of starch. You want to make sure you get enough vegetables in, particularly green leafy vegetables, and also fruit. So what happens? Why are we talking about this? Well, the problem is obesity, and obesity affects about when you combine overweight and obesity, it affects about 2/3 of the U.S. population. So obesity can lead to diabetes. And diabetes is a very bad risk factor that we have. And matter of fact, there are about 30 million people in the United States that are diagnosed with diabetes. Now, there are another 90 million with what we call pre-diabetes. That means they almost have diabetes. And we use something called the hemoglobin A1C to measure that. And so you should ask your doctor and know what your hemoglobin A1C is. So if your hemoglobin A1C is above 5.7, that's considered pre-diabetes, and if it's above 6.4, that's diabetes by definition. So why am I stressing that? Because if the black patients, African Americans, the women particularly, have a 60% increase in the risk of being diagnosed with diabetes. If you're African American, the risk of dying is twice than if you're white. So those are risk factors. The risk of kidney failure is 3 times greater among blacks than among whites. So those are things that have to do with your weight and obesity. And so we divide obesity into categories. We talk about normal weight, and we use a term called a BMI, body mass index. That's the ratio of your weight to your height. And so a normal body mass index is between 18 and 25. Overweight is between 25 and 30. They would get in the category of class 1, class 2, class 3 obesity, where the BMI goes from 30 to 40. And so your BMI is above 40, and that's considered morbid obesity or clinically severe obesity. And then we have another category where your BMI may be greater than 50, which is called super obesity. So these things impact on your lifestyle. It impacts on your lifespan. It impacts on how likely you are to die. All those things, it impacts on how likely you are to develop diabetes or high blood pressure or sleep apnea, high cholesterol. And there are some risk factors for diabetes, which include being overweight and obese, also high blood pressure, having a high cholesterol level, and also cigarette smoking. So those are risk factors. You want to eliminate as many of those risk factors that you can. So when we talk about being severely overweight, we talk about people that require a surgical procedure. And that's considered if your BMI is above 35 in a category, particularly if you have high blood pressure or diabetes or high cholesterol or what we call sleep apnea. And so those are kind of things that we look at when the patients are considered candidates for surgery, because that's a severe condition. And we know that with surgery, we can reverse some of those things. We can reverse diabetes, for instance. So there are 2 procedures that we use for bariatric surgery. One is called a restricted procedure. That means it's restricting how much you can eat at one time and how fast you can eat. That procedure is called a sleeve gastrectomy, where we remove about 70% of the stomach. We also remove a part of the stomach that contains a hormone called ghrelin, and that hormone controls your appetite. So when you decrease the amount of ghrelin that you have, you decrease your appetite. You combine that with the sleeve, where we're taking about 70% of your stomach, then you can't eat very much, you can't eat very fast, and you're not as hungry. That's one procedure. Another procedure that we do is called the gastric bypass. This procedure, you have a small stomach pouch. You have a narrow opening between your stomach pouch and your intestine. You also bypass the part of your small intestine, and you have something called dumping. That's where you have to make sure that you're not taking in refined sugar. Now, what I mean by refined sugar is sugar that you add to food. Candy, cake, ice cream, cookies, donuts, that type of thing. So you want to avoid those things, because you can develop a condition called dumping, where you get diarrhea, sometimes you get lightheaded or dizzy. But the good part is, by avoiding sugar, you increase your weight loss. And your weight loss becomes dramatic, because you're not spiking insulin, and you're not causing your body to store fat. Those are some simple things that you can do. I hope that these things have been good for you in terms of from an educational standpoint. Thank you.